So right now is the perfect time to educate your teen on forms of birth control. Your teens are home, maybe you have to go to work, and those conversations are important. It's even more important when that information comes from you. There was a recent survey done with 2,000 women ages 18 to 50, and they found that only 16% of women learned about birth control from their parents, and 1 in 5 of those women never learned about birth control at all. So parents, did you think that your teens were getting sex education in school or even having conversations about birth control in school? Think again. The Gateway Law states that school sex education programs should focus on abstinence-only education. So no, they're not having those birth control conversations at school, which is all the more reason why this information should come from you. So start those conversations early and have them often.
Hey parents and teens, abstinence is the only 100% effective way to prevent pregnancy and sexually transmitted infections.
Let's talk a little bit about condoms. What do you know about condoms?
I know that they protect you from STIs.
The condom is the only birth control method that protects against STI. And even if you're on another form of birth control, it's important that you're using condoms to prevent STIs. Dual protection.
Double prepared.
Yep. So awesome. Great conversation. I wanted to be sure to mention that I have provided some mentors in this video because I also think it's important for teens to see other people's perspectives and their experience with different forms of birth control.
So my mom was telling me about the Depo Shot, and I wanted to ask you a few questions about it. So what is the Depo Shot and how does it prevent pregnancy?
So the Depo Shot, it's a prescription provided by your healthcare provider, and it contains a hormone. So it's an injection that goes in your hip or your arm every 12 to 13 weeks. And so the hormone, it stops ovulation and it thickens the wall, the mucus in the cervix. And so with that, it prevents pregnancy and it keeps sperm from entering into the cervix.
Okay, cool. So how effective is the Depo Shot at preventing pregnancy?
It can be very effective. It can be 99% effective, but due to human error and people not taking their shots exactly every 12 to 13 weeks, it can only be 94% effective.
So what are some benefits and side effects of using the Depo Shot?
So some great benefits is it helps you with a lighter period. It can eliminate your period altogether. And the most common side effect is irregular bleeding.
So does the shot protect against sexually transmitted infections?
People should use a condom as well while you're still on the shot.
Okay, well, thank you.
So before we get into talking about the birth control pill, it's important to note that there are a variety of birth control pills. Specific brand that a pill is determines the kind of hormones, whether it's progestin or estrogen and progestin together.
So what is the birth control pill and how does it work to prevent pregnancy?
What it does is it stops the egg from ovulating, which if there's no egg, then there's no pregnancy. It also thickens the mucus around the cervix.
How do I take the pill?
The birth control pill is taken at the same time every day.
How effective is the pill in preventing pregnancy?
The birth control pill with perfect use is 99%. And by perfect use, I mean taken on time, at the same time every day without forgetting, but a lot of people aren't perfect. So in reality, it's about 91% effective, which means 9 out of 100 pill users get pregnant each year.
What are the side effects and benefits of using the pill?
So they don't actually happen to everybody, but the most common side effects are spotting or bleeding between periods. Some of the benefits are they can help keep track of your period, lower period pains and bleeding. It can also help with acne.
And does the pill prevent STIs?
No, the birth control pill does not prevent sexually transmitted infections, STIs. So if you are sexually active, make sure you're using your condoms with the pill.
We're having these birth control conversations. Do you like any of those options?
I like the pill, but
But what did you say about the pill?
It's a lot of work.
It's a lot of work. Yeah.
Mom, I'm curious about the birth control patch in the vaginal ring.
The patch is like a large band-aid that sticks onto the skin and must be changed every week. There are 2 hormones in the patch. These hormones get absorbed into the skin and stop ovulation. It also builds a thick mucus in the cervix to prevent sperm from finding its way in. Stay back, sperm! When changed weekly and on time, the patch can be quite effective, 99% effective. But people aren't perfect, so in reality, the patch is only 91% effective. About 9 out of 100 patch users get pregnant each year. But it also has other benefits, like helping with acne or providing lighter, regular periods, and may help with cramping. The most common side effects are spotting or bleeding between periods, sore breasts, nausea, or headaches. So it's good to remember that everybody is different, and some may not be affected by these side effects. The patch does not offer STI protection, and that is why it is important to use condoms along with the patch for protection against infections.
What a great resource it is to have a big sister and mentor around. And even if there's not an older sibling, there is always somebody who is trustworthy in your community or in your family where these teens can go when you are not around to provide that information. Be sure and have those conversations with your teen as well. Trusted adults can make a big difference in a teen's life.
Okay, so my mom and I were talking about the vaginal ring, and I wanted to ask you a few questions. And so what is the ring and how does it work?
Is a plastic flexible like jelly like bracelet almost that you insert into the vaginal canal. It lasts up to 3 to 6 weeks depending on your lifestyle. So
the ring has progestin and estrogen, may stop ovulation, but it also thickens the mucus in the cervix to prevent the sperm from entering the uterus as well.
How effective is the ring at preventing pregnancy?
So the ring is 99% effective, but like the thing is you have to get a prescription for the ring, and also if you don't like insert it correctly, it could be up to 91% effective. Of course, we're all humans, like we're gonna make mistakes.
What are the side effects and benefits of using the ring?
So some side effects are nausea, some cramps. It also helps with like your acne. It helps with like your periods. So say you have like a heavy flow, sometimes it'll make it lighter.
Does the ring prevent sexually transmitted infections?
It does not. I don't think there's any birth control that will help with STDs.
Can you tell me a little bit about the IUD and implant?
Yeah, I can. So I have a sample right here. This one is the Mirena IUD. There are 5 different brands of IUD, but this particular one is one that will stay in the uterus for up to 5 years. This is called a hormonal IUD, and it is a flexible plastic about the size of a paper clip. And it actually goes in through the vagina, through the cervix, and it is placed inside the uterus. This is the size of a uterus. That's how small it is. Inside this capsule here, right here, is where the hormone progestin is located. And what progestin does is it helps to thin out the lining of the uterus.
And what are the side effects and benefits of using the IUD?
So some side effects that people do experience, but remember all bodies are different, is that there may be some cramping, there may be spotting, bleeding. Periods do tend to stop for most people, and that's why it helps with women with heavy bleeding or blood clots or painful periods. There are removable strings, and those removable strings at the bottom, you just pull the string, the arms will collapse and it will pull right out. So like I said, there are 5 different brands. One I didn't mention is one that is non-hormonal. And non-hormonal means that the IUD does the same exact thing, goes in the same way, but it has no hormones. It is wrapped in copper, and copper is toxic to sperm.
Oh.
Do you have any questions with that?
Does the IUD protect sexually transmitted infections?
It doesn't. That's a really great question. So a lot of times teens think that just because I'm on the IUD, I am protected. And you're not, because what do we know is the only method that can prevent STIs?
Condoms.
The IUDs are 99% effective against prevention of pregnancy. So these devices are 20 times more effective than the pill, the patch, or the ring. Do you have any idea why they're more effective? No? You know, when we talked about the pill and the patch and the ring, somebody had to remember to do something, right?
Yeah.
With these, once they're inserted, a woman doesn't have to think about it for 3, 5, 12 years down the road. So when we remove human error, that offers more protection. Okay? Awesome.
So, what is the arm implant and how does it work?
So the arm implant is the Nexplanon, and I have a sample of this one here as well. So like imagine this is my upper arm, right? And what a doctor is going to do is going to numb this area. And once it's numb, they're going to insert this device, which is about the size of a matchstick. So it's about an inch and a half. It's flexible. And again, it's like a capsule. So the hormones are inside there.
And how effective is the arm implant?
So because, again, when we're talking about perfect use with the implant, we never have to do anything. So once it's in our arm, we leave it there for up to 3 years, and that offers us about 99.9% effectiveness. Just like the IUD, once it's in there, you don't have to think about doing anything on a daily basis or a weekly basis. So this one is also 20 times more effective against preventing an unplanned pregnancy.
And what are the side effects and benefits of using the arm implant?
So some side effects reported are spotting, more periods a month than normal. But again, another benefit for this could be lighter periods or no periods at all.
Does the arm implant protect you from STIs?
No. So what have we learned so far? Does any birth control protect anybody from STIs?
Nope.
There's one. Which one is it?
The condom.
And that's it, folks. The condom. So both of these are a more effective brand of birth control for women. So if women are looking for effectiveness, these are great options when compared to the pill, the patch, and the Depo Shot. So, yeah. So the last thing that I would like to mention is that the American Academy of Pediatrics recommends IUDs and implants as a first-line method when recommending birth control to teens. And that is because these methods offer 20 times more protection against unplanned pregnancies.
If the time is right, I will be prepared and ready to be sexually active. Parents, if you like this great book for your teen, go to A Step Ahead Chattanooga's website, fill out the form to get it mailed to you for free.